Hello, I am Dr. Fujita from the Sapporo Cardiovascular Clinic. Today, I will explain how to use a bilateral catheter for transradial approach procedures, which is now widespread throughout the world. The advantage of a bilateral catheter is that they can perform coronary angiography with a single catheter. As a result, procedure times are shortened and radiation exposure time is reduced. Additionally, the catheter does not need to be replaced, which prevents cerebral infarctions and head spasms, and ultimately leads to cost reductions. Today, through this video, I will share my know-how on the use of the Jacky Catheter, which I developed. The Jacky Catheter is characterized by the shape of the first curve, which bends to allow for coaxial engagement. The second to fourth curves are gentle curves in order to make it easier to extend the catheter. Additionally, it has a shape that can be retracted when backup is required. There are two main ways to engage a Jacky catheter to the left coronary artery, a method that is similar to Judkins catheters, and a method that is similar to the engagement of a Sohn's catheter. As the basic method, we will first look at the Judkins technique. After advancing the guide wire to the cusp, extend the catheter under the ostium of the coronary artery and remove the wire. Slowly rotate it clockwise. The catheter engaged. To fix it in place, slightly push it. If you press too much, then it may dislodge. So find the right balance. Depending on the case, pushing it even further will fix it in place even more. You may also apply the torque counter clockwise. As shown, when operating the catheter, hold it with both hands and straighten the catheter to apply torque. Next, we will look at the Sohn's method. If the catheter cannot enter via the Judkins technique, then position the catheter in the cusp. You can have it engaged by continuing to push and pull while rotating it counterclockwise. If you stop while it is being pushed, it will fix in place. After engaging the LCA, pull on the catheter. While rotating it clockwise, push the catheter and drop it into the right cusp. Engage the catheter while pushing and pulling. Another method is to push the catheter up from below and into the RCA. Rotate it in the cusp. Press to engage. Pull the catheter to dislodge it. To engage with the RCA, rotate the catheter clockwise, and to engage with the LCA, rotate the catheter counterclockwise. If the guide wire accidentally goes towards the descending aorta, then pull the guide wire and rotate the catheter counterclockwise. If the catheter is pointing towards the ascending aorta, then insert the wire into the back. Then, continue pushing the catheter forward and bring the catheter tip down. Remove the guide wire. Engagement can be difficult if the aorta is dilated due to arteriosclerosis, in other words, if the LCA is facing upwards. When this happens, push up from below. After pushing the catheter while rotating it clockwise, rotate it counterclockwise. If it still does not enter, then you cannot engage via this method. In that case, pull the catheter and then rotate it clockwise. If you still cannot engage even after trying these two methods, then switch to JL 3.5 or JL3. If you have difficulty engaging with the RCA, then switch to JR4. If the catheter is not fixed in place well, or if the catheter becomes dislodged when performing coronary angiography, then rotate it clockwise after entering. Doing so will fix it in place better. If you rotate the Jacky catheter clockwise while it is engaged in the RCA, then it will accidentally go deep into the RCA. If the catheter is too deeply engaged in the RCA, then there's also another method of slightly pulling the catheter. Or you can reinsert it and push it up from the bottom. If the catheter is rotated clockwise and goes deep into the RCA, then note that the tip of the catheter may contact the RCA. Before injecting the contrast media, look at the pressure waveform and make sure to confirm that the catheter is not wedged in and that the catheter tip is not in contact with the inner vessel wall. If the catheter cannot be rotated as you intend, due to a very tortuous route or due to the presence of loops, then with the guide wire still inside the catheter, push and pull the catheter back and forth to move it. In this way, move forward while slightly rotating the catheter clockwise and counterclockwise. If the guide wire does not smoothly enter when you initially push it forward, then there may be a tortuous route, so it is suggested that you decide to operate with the guide wire still inside the catheter. Similarly, when engaging with the RCA, push and pull the catheter back and forth while rotating it clockwise. If you operated with the guide wire inside the catheter, then it will be less likely to kink. Take a deep breath in. Breathe in deeply. One trick for when engagement doesn't go well is to have the patient take a deep breath in and then engage while they're doing so. For patients for whom a catheter in a smaller size than the Jacky catheter is desirable, the deep breath is intended to allow the Jacky 3.5 to engage because the deep breath stretches the aorta and lowers their heart, increasing the distance to the coronary artery entrance. Learn the proper technique, practice with the model to become familiar, and then confidently use it in a clinical setting.